The systems based clinical masterclass. Let's begin with the jugular venous pulse, or GVP. It is defined as a reflection of the pressure changes in the right atrium throughout the cardiac cycle. Clinically, we observe this at the time internal jugular vein because there are no valves between it and the right atrium, allowing us to estimate right atrial pressure. The JVP consists of the several waves. The A wave represents atrial contraction, while the V wave is caused by venous filling of the atrium. A common exam favorite is the C wave, which is caused by tricuspid valve bulging. This occurs during early ventricular systole. As the right ventricle contracts forcefully, the valve snaps shut and the closed cusps bulge backward into the right atrium. Coming on to clinical cardiology, aortic regurgitation. In severe aortic regurgitation, the physiology is defined by a massive stroke volume ejected during systole, followed by rapid backflow into the left ventricle during diastole. This creates an extremely wide pulse pressure that manifests through several famous peripheral signs. Peripheral signs of aortic regurgitation, the eponyms. First is Quincke's pulse, alternating capillary blanching and flushing in the nail beds. Second, Trobbe's sign, a pistol shot booming sound heard over the femoral artery. Third is Demusset's sign, rhythmic head bobbing in sync with the heartbeat. Fourth is Hill's sign, the most quantifiable sign where popliteal systolic blood pressure exceeds brachial blood pressure by more than 20 mmHg and more than 60 mmHg in severe cases. Now comes your clinical anatomy, architecture of the maxillary artery. So true branches are infraorbital artery, sphenopalatine artery, greater palatine artery. The impostor, the supraorbital artery. This is not a branch of the maxillary artery, it arises from the ophthalmic artery. Coming to the next important topic, which is tonsillitis and referred earache. Consider a patient with swollen palatine tonsils and a high fever who also complains of an earache. The sensory input for both the tonsils and the resulting referred otalgia is carried by the glossopharyngeal nerve. The pain is transmitted to the middle ear via Jacobson's nerve, a branch of cranial nerve 9, because the brain misinterprets signals from the inflamed tonsils. Next is embryology of the tongue. The tongue's development is complex. While the mucosa comes from pharyngeal arches, the musculature, with the exception of palatoglossus, develops from occipital myotomes. These cells migrate into the mouth, dragging the hypoglossal, which is cranial nerve, 12th cranial nerve, along as their motor supply. Now this is about laryngeal muscles and laryngeal airway control. In the larynx, posterior cricoarytenoid PCA is the lifesaver because it is the only one that abducts or opens the vocal cords, whereas if you see the transverse arytenoids, they are adductors, means they close the vocal cord. So PCA is the sole abductor. Coming to dental age and maturation indices. Demirjian method is the standard for assessing development, assigning stages A through H to teeth based on radiographic criteria. They are classified as A calcification to H apex closure, converted to a maturity score. Shore and Masler is a visual comparison against 21 chronological templates, whereas Gustafsson evaluates regressive changes like attrition, secondary dentine, root transparency. Dental anatomy. In dental anatomy, the ratio of mesiodistal width to crown height in a maxillary canine is approximately 80%, specifically 75%. If we look at the microscopic level of the tooth, the lamina limitans is the organic glycosaminoglycan rich lining that coats the inner surface of the dentinal tubules. The last topic is the beta oxidation of odd chain fatty acids. We look at the oxidation of fatty acids. While even chain acids break into acetyl-CoA, odd chain fatty acids produce a unique final 3-carbon product, propionyl-CoA. This propionyl-CoA is eventually converted into succinyl-CoA to enter the TCA cycle, a process requiring biotin and vitamin B12. So that's all for today. Hope you enjoy the 10 questions 10 topics which we discussed today, and there are many more to come, so just stay tuned and keep enjoying the content. Thank you.